I'm going to publish this video also on my German YouTube channel, although I'm speaking in English. But the reason why I'm doing this in English now is I just want to reach out to more people, and more people speak English than German. Maybe I should also do the same video in Hebrew, I don't know yet. Okay, I'm starting. One of the best decisions I've ever made in my life, and it was actually a decision I made almost a year ago, in March last year, 2023, was moving my medical file from Sharett to Hadassah Ein Kerem. If I hadn't done this, and I can talk about it now after some experience and treatments I underwent, either I would be dead now or very bad off physically. So I have to tell you that I'm an oncology patient. I was diagnosed with leiomyosarcoma, LMS cancer, a bit more than 5 years ago. And I was a cancer patient at Sharett Medical Center here in Jerusalem for 4.5 years. And my condition was like, I had surgery. After my first surgery, which was very professionally done at Sharett, cancer was back after 3 months, and afterwards I had 2 tumors in the stomach area and the abdomen area, and it went on and on. So I was, for almost 4 years, I was on different chemotherapies. And it was right. It was not a wrong decision to put me onto this. It was standard treatment for leiomyosarcoma. Nothing special, but standard treatment. So every 2-3 months I had a CT, sometimes a PET CT. I've never had an MRI at Sharett. I had this later on at Hadassah Ein Kerem, but I've never had an MRI. I've had, as I said, PET CTs and CTs. And then, some years ago already, they found a nodule on the upper part of the lung. I think it was the upper part, or the middle part, I don't even remember. And Sharett then did not have radiation treatment. So whoever needed radiation treatment was sent to Hadassah Ein Kerem Hospital, because they have a very professional radiation department with a great oncoradiologist. He's great. I'm not saying any names here, but he's great, and if he sees this video, you are great. You're a very good doctor and very nice. So I had radiation treatment there, but I was still a cancer patient at the Oncology at Sharett. And as I said, for 4 years I had 4 different chemotherapies, and I had this for 4 years almost without a break. I was on chemotherapy. And in between I had another surgery, a very heavy-duty stomach surgery with a very good surgeon. And the problem already occurred after the surgery, because I was not, I was told that at Sharett by someone else, I'm not saying who, but my oncologist should have put me back right away on chemotherapy after surgery, but this didn't happen, and after a few months cancer was back. And it was like half a year ago, I felt here in the lower abdomen area near the hip on the right side, I felt like something pushing. It was hurting and pushing. And when I was trying to tie my right shoe or put on my right sock, I had, it was pushing and something was bothering. And usually this is a sign of a new tumor. So I had a CT, and the surgeon from the previous surgery, he checked, and my oncologist checked, and I was told there's nothing, it's just post-surgery pain. But I knew there was nothing, but I got used to it. In the course of the time, I got used to something bothering. And then I had, at the same time, I had 2 tumors very close to the liver. If anyone is interested, it was segment, if someone knows about livers, it was segment 5. So I had 2 tumors outside the liver, very close to the liver. So I was put on my 4th different chemotherapy called Yondelis, also known under the name trabectedin. And I started that treatment in March last year, 2023. In March 2022, the year before, 2 years ago. In March I started the treatment, and it was stopped in, first it helped, it shrunk the tumors next to the liver. And then the tumor started growing again, which was about, a little more than half a year later. And so we stopped Yondelis. And then my oncologist at Sharett Institute, I had the feeling he didn't really know what to do. So I suggested my very first chemotherapy, which was gemzitaxotere, because it had helped a lot 2 years before, 3 years before. And I said, why don't we try out that again? So he agreed. I had 4 treatments and everything went wrong. The tumors grew. I had another CT in January 2023, and the tumors had grown. So my oncologist at Sharett Institute suggested radiotherapy, because in the meantime also the oncology in Sharett Institute had moved into a new building. They built next to the main building of the hospital, they built a brand new oncology building. And there they also offered radiotherapy now. So patients, oncology patients at Sharett Institute are not being sent to Hadassah Ein Kerem anymore. I mean, you can still choose. If you want radiotherapy at Hadassah Ein Kerem, you can still go to Hadassah. No one can stop you. So I was suggested, because of these 2 tumors next to the liver grown, I was suggested radiotherapy. And so I thought about having this again at Hadassah as I had before with the lung. And then I thought, like, it was a misunderstanding between my oncoradiologist at Hadassah and me. I got something wrong. It was a total misunderstanding. Whatever. So due to this misunderstanding, I said to my oncologist at Sharett Institute, okay, why not have radiotherapy here in your new building? And he was so happy. He almost jumped, I don't know, up the ceiling. And later on I saw why. Because they had moved to the new building 3 months before and started their radiotherapy there, and they had no patients. I mean, I was there a few times, I didn't see anybody. I mean, there were maybe 5, and this was a lot, waiting. They didn't seem to have any patients. Well, I hope they still don't. But let me tell you why. So I had, they call it simulation. This is a certain procedure you have before actual radiation. It's like marking the spot where the tumor is. So they mark it, they have a special procedure, you have to they have a CT there, and they do this right there. So they mark the spot, so when you go a week or 10 days later to your actual radiation treatment, to your first treatment, so they know exactly where to point this machine at, because it's marked, the spot. So I had this simulation at Sharett Institute, at the radiotherapy. And I was told that first, before they start, I'm gonna talk to a doctor, and then to a nurse, and then I'm having this simulation. Okay, so I expected an oncoradiologist, like at Hadassah Ein Kerem, someone really professional, familiar with the whole radiation, explaining everything. But no. Who was sitting there? My oncologist. My oncologist. He's not, you know, he's not a professional with radiation. I could have done this myself. And he explained something, how they're going to do this, but it sounded like, you know, I knew something was wrong. And I said twice, I said to him, are you sure you are professional here? Yeah, professional. And I said, you know, I'm afraid that you are not. And instead of like hitting the tumors next to the liver, you're going to radiate my toe. I don't know. It was like, no, professional. But he couldn't even find the picture of the 2 tumors. I said, can you show this to me on the computer and where you're gonna hit the ray, so to speak? So he looked through the computer, he couldn't find the picture. And I was already about to tell him, you know, I know where it is, let me use the computer, I show you where it is. So he couldn't find the picture. And he said, oh, here it says CT result close to the liver, so we're gonna do 3 treatments. And now you can go to radiation. Here sign papers, simulation. Not to radiation yet, to simulation. And I thought, okay, I had a very bad feeling. So I did the simulation process, which was okay, but I was used something more professional from Hadassah Ein Kerem. I was always, you know, I had a comparison. If you don't have a comparison and you go to Sharett Institute, to this radiation, you think that this is it. This is how it's supposed to be. But I had a comparison, and I saw, at least when I did this, which was, I had simulation at Sharett Institute on the 22nd of February 2022, a year ago. And I thought, no, this is not it. And I was laying there and thinking and already regretting not going to Hadassah Ein Kerem and having this done there. And I was very upset already then. And on the 26th of February, 4 days later, I had an appointment about something else, about previous radiation onto my lung, with my oncoradiologist at Hadassah Ein Kerem, because I had the CT, and he wanted to tell me if everything is okay with the nodule on the lung. And he explained to me right away about radiation onto the two tumors next to the liver. And I said, you know what? I've made arrangements with Sharett Institute. Well, well. And he told me how he would do it. He said, first of all, because I told him that I was supposed to get 3 treatments. He said, no. You need at least 10, up to 15 treatments. And he said, and I want you to know that this could be life endangering because the tumors are very close to the small bowel. And we have to be very careful. He said it can be done, but it's a little tricky. He said, but we have to be very careful because if we hit the small bowel, there's a danger that you could die. And he said, have they told you that at Sharett Institute? And I said, no. Everything new to me. And this was the moment when I knew that I would never have any radiotherapy at Sharett Institute. Never. I was shocked, and I didn't know what to say, and my whole day was ruined. I was upset about myself because I had made the wrong decision. I should have gone to Hadassah Ein Kerem to the radiotherapy and never to Sharett Institute. So I stayed in touch with my radio oncologist at Hadassah, and I said, you know, I want to do this here. I cancel Sharett Institute radiotherapy. I'm doing this here at Hadassah. And he said, but I want you to have a new simulation here because I want it my way. And I said, fine. I'm having another simulation, marking the spot. It only takes a few minutes. There was only one problem. Because my health insurance had already paid for the simulation at Sharett Institute, the question was, would they pay again for Hadassah? Because I already had a simulation. So Hadassah Oncology got in touch with my health insurance. They phoned me up and they said, I'm with your health insurance on the phone right away. And they have 2 questions. 1, have you started your actual radiation treatment at Sharett Institute? And I said, no, I just had simulation. I haven't started any treatment yet. They said, fine. The second is, they would pay for your simulation here at Hadassah under the condition that you move your whole oncology file from Sharett Institute to Hadassah. Only then. If not, no. And so I said, you know, I don't know if I really want to do that because I got so used to Sharett Institute. And I said, I don't know. And it was a Thursday noon, and the secretary said, listen, today it's Thursday, think it over the weekend, and let us know next week. And I said, fine. So I was thinking. And the more I thought about it, the more I wanted to move my file to Hadassah. And on Saturday night, I looked up the website of the Oncology at Hadassah. And what do I see? They have a sarcoma clinic. They have trials, because Hadassah Ein Kerem, they are a university hospital. They have trials, they have research, they have programs, they have so many things to offer. Hadassah, Sharett doesn't have. I was never offered any research trials, genetic testing. Never. I had standard procedure chemotherapy and 2 surgeries, but nothing, you know. If this hadn't helped, you know, goodbye Charlie. And suddenly I see sarcoma clinic, real sarcoma specialists. They have someone called sarcoma specialist, a woman at Sharett Institute. I've never seen her. She was never suggested to me. She never asked, is there anybody with sarcoma here? I never talked to her. So I saw all these offers at Hadassah Ein Kerem. And I was, first of all, I was very upset because, you know, at Sharett Institute, they should have told me, listen, you have sarcoma, stage 4, and Hadassah Ein Kerem has a sarcoma clinic with all kinds of offers. Why don't you go there? We really here don't have trials. We don't have anything. We have standard procedure. If it doesn't help, go to hospice or whatever. They should have told me that. But you have to understand, Hadassah Ein Kerem and Sharett Institute here in Jerusalem, the 2 biggest hospitals, they are competitors. And especially Sharett Institute, I have the feeling they see Hadassah as a kind of enemy. Big competition. So they never told me anything. It was a miracle they sent people for radiation to Hadassah, but they didn't have another choice. There was nobody else. Unless you go to Tel HaShomer near Tel Aviv. So I saw all these offers and everything. So I talked to Hadassah. I phoned them back. I talked to Hadassah. And they said, you know, we make an appointment for you. And you're going to talk to an oncologist here who really, really, really professionally deals with sarcoma. And I said, fine. And they said, you talk to him and see. And I went, and, you know, it was such a difference. Going to see this oncologist, he is good. He is good. It was such a difference. It was a different world. He's so professional. He's like, he's not sitting and Googling or something, as I was used from Sharett Institute. He was like, you know, I went with a friend, and we sat down, and he was already research here, research there, here. Maybe you want to join this program. Here's research. Looks through the papers if you want it. We can do it. And he was like, it was like boom. You know, at Sharett Institute, it's like, yeah. Then we're gonna book this, and we do this, and you know, at Hadassah it was like boom, 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 boom. And, you know, I couldn't even think that fast. I was totally overwhelmed with information, with what they're gonna do, and blah blah blah. My oncologist, and the oncologist there at Hadassah, he wants to be on top of things. He's not like, oh. It was, you know, we were sitting there stunned. It was a total different world. And my oncoradiologist, he also came, and he said, you know, it's actually not a good idea to have this radiation treatment because it won't do anything. Even if we did it and it went well, it wouldn't really last for too long. So the best thing to do is surgery. Surgery to me was also suggested for a little moment at Sharett Institute to take out the 2 tumors next to the liver, but my surgeon said he wouldn't do it. He would not do surgery because the tumors are still too small. So now I was at Hadassah, and they said we would do surgery. And so I moved my whole file to Hadassah Ein Kerem, and I had surgery. And guess what? The same day I spoke to this new oncologist. 2 hours later, I had, by the way, I was sitting with him for 2 hours. He really took his time. He wanted to get to know the case, and he is like, he wants to be on top of everything. He wants to know, and he wants to get the whole picture. It's very different. It's a very different attitude. He's very professional. He's extremely professional, and he knows what he's talking about. And he said, I'm an oncologist. I'm not a radiotherapist or a radio oncologist. He said, I don't know about radiotherapy. I'm an oncologist. And my onco-radiologist says, I have no idea about chemotherapy or anything. I'm a professional with radiotherapy. But at Sharett Institute, you know, you have someone, and he says, I'm a professional here, I'm a professional there, and he doesn't even know the other stuff. So at least admit that you don't have any idea, or at least not much. But don't send patients to the wrong treatment. Oh my God. So I went to see the surgeon the same day in March when I met my new oncologist. And he looked at the pictures of the last PET CT I had at Sharett Institute. He looked 10 seconds, something. And he found the pictures. And so he looked at the 2 tumors next to the liver, segment 5. And then he said, after a few seconds looking at the pictures, the PET CT pictures, he said, and what's this? And I said, what? And he said, you have another tumor. You don't have 2 tumors, you have 3 tumors. There is another tumor below. Sharett Institute hadn't even spotted on the picture. The pictures were from Sharett Institute PET CT, and they had missed for a year. They had missed this tumor next to the hip. I always suspected to be there, and I was told post-surgery pain. And it was actually a tumor. And Sharett Institute, whoever was like looking at PET CT pictures, didn't even see these tumors. They missed it for over a year. And this surgeon at Hadassah Ein Kerem, he looks at the pictures for 10 seconds and he says, and what's this? There's another tumor. He sees it within 10 seconds. And Sharett Institute doesn't see it for over a year. You know, I was really pissed off. You know, I thought like, it's great that I'm gone from there, you know, that I'm, oh. Well, I had a surgery. I switched to Hadassah Ein Kerem in March last year, as I said. I had surgery in May. And the surgeon, who is also like an oncology surgeon, he's a professional oncology surgeon, also for sarcoma. He took out 5 tumors in the end. 5 tumors plus my gallbladder. Because another tumor had also already grown next to the 2 tumors into the small bowel. And the 2 tumors next to the liver had already grown onto the liver. And there were 2 other tumors. So I had 5 tumors taken out in May. And after leaving hospital, I was in hospital for 5 days. It was, surgery took 7.5 hours. when I was home and during the summer and everything, recovering from surgery, I was sitting down and thinking, what would have happened if I had stayed at Sharett Institute undergoing radiation by apparently people who told me the wrong amount of radiation, like 3 treatments, and I wasn't even told that this is life endangering, and I had no details. You know, the onco-radiologist at Hadassah, he sits down with you and he goes into every little single detail and he knows what he's talking about. You know that he knows what he's talking about. And in Sharett Institute, I was told nothing, and it was just like, go lay down and shut up. So I was thinking, after this big surgery, you know, I was really grateful. I was so happy that I have moved hospitals, and I thought, like, where would I be now if I had stayed and undergone this whatever radiation at Sharett Institute? When Hadassah took out 5 tumors, I would have been, after a few months, if I had stayed at Sharett Institute, I would have been off very, very bad. Worst case scenario, dead. Because they didn't detect one tumor at all. I don't know if the others were already there or not. Apparently not. They grew in the course of time, from January last year when I had the PET CT until May. But I had 3 tumors and not 2, and Sharett Institute didn't detect it, the 3rd tumor. And they had time for a year, and no one saw it. So this is my experience with the radiation department at Sharett Institute. I hope for every cancer patient at Sharett Institute, I hope that the department has improved. I really hope so, because it would have been would be a disaster. I'm glad to be out of there, out of the Sharett Institute Oncology, and it's also better for me as a sarcoma patient to be at Hadassah. Hadassah has like this slogan. They want to prolong life of a cancer patient and limit pain. This is their goal. And they do much more. They also have more possibilities. I had genetic testing, for instance. After, what, 2-3 months at, it was already, my new oncologist already told me this right at the first meeting, genetic testing. I had been an oncology patient at Sharett Institute for 4.5 years, and no one ever said anything about genetic testing. I don't know if they do this. Not about research, not about trials, not about all kinds of methods, things, new stuff. There was nothing. I'm glad as a sarcoma patient that I left Sharett Institute, because, as I said, at Hadassah I have more options. I have many more options. It doesn't mean I live forever. I could still die, whatever. But I have more options. And it gives you a much better feeling. It gives you a positive feeling. And when you have an oncologist like mine now, I'm not saying the other one was wrong. I'm not saying this at Sharett Institute, but he did standard procedure. Radiotherapy would have been a disaster. This was the wrong decision. But it was standard procedure I got at Sharett Institute. But at Hadassah I had this huge surgery, and a month later they found, and they phoned me right away. Not like, make an appointment, and we're gonna meet sometime. No, they phoned me right away and they said I have another tumor on the right side, sorry, on the left side of the body. And they hadn't seen it during surgery. It was probably already there, but because all my tumors are usually on the right side, there was no one looking too much on the left side, and I also wasn't paying attention. So I had a new tumor there, or it was already there, who knows. And I had radiation on this tumor in July last year, 5 treatments, and it helped. It shrunk to almost nothing. So since I had my surgery in May last year and radiation in July, I have nothing. I'm still recovering from all these years of treatment, which is not easy. Of all this chemotherapy and everything, I move much better now. I can go out. I still have difficulties. I'm still very tired and everything, but I feel stronger. And I have something to look forward to. And since then, since surgery and radiation treatment last year, I have nothing. I still have 2 tumors. I mean, this shrunken one on the left side of the stomach, and the nodule in the lung, but they are stable. They are not growing. They shrunk. At least they don't grow anymore. But this is all I have at the moment. And I've never had this before. It's like a miracle, because for years I went from one tumor to the next, one treatment to the next, which is okay. But as I said, it was standard procedure. But I don't know what they did, but it hasn't come back yet. So now it's January 2024. And next month, exactly in another month, I'm having a next CT scan to see what's going on. If there's still nothing, or nothing new has grown, so I may go back to a normal life, which is not easy. You know, for 5 years I've been here and there in hospital. Hospital was my life, health insurance, whatever, doctor. It was my life. It has become daily routine. And now it's not there. You know, it's first you have the difficulty to get used to have cancer, and now you have the difficulty to get used to there is no new tumor. You can maybe slowly go back to life. I mean, to your normal routine. But I have to see how it goes next month, if something is growing. My oncologist at Hadassah Ein Kerem and I, we both know very well that this is not the end of the illness. It can come back any second, and we know that. It can come back, it can get worse, it can get whatever, and we both know that. I'm very aware of this, and I'm not having a party now and celebrating, but I should have a party or something and celebrating, or at least be happy, which I am. I'm not having a party, but I'm very happy, as I said at the beginning, that I've switched hospitals at the right time. This was a big decision, a very important decision, and the decision that probably saved my life, at least for now. What's coming in the future, this year, next year, I don't know. But it has saved me from anxiety, because as a cancer patient, it's very important to have a working medical team, like a good surgeon and a good oncologist and a good onco radiologists and everybody around, and nurses and everybody around. This is very important to a cancer patient. It's very important, because when you have this, you are not full of anxiety, because you know you can rely on treatment. You know that people try to help you, and that they don't just dump you onto a bench at the radiotherapy and tell you something and don't care. Just maybe just to have some customers. The best thing at the Sharett Oncology, and I want to thank them very much, is the Ishbuz Yom, the outpatient department, where the nurses are and give chemotherapy treatment. They are very good there at the Ishbuz Yom. Very nice nurses, also very professional, and I thank them very much. I had a few. I had a regular nurse, Dancy, and I had some others when she wasn't working or when she was on holiday, and I thank them very much. And I think that Ishbuz Yom at Sharett, where you get chemotherapy, it's a very professional department with very nice nurses, and that's the best part, if you can call it, like in oncology, the best part. It's the best part of the Sharett Oncology. And I'm talking about myself. I'm talking as a sarcoma patient. How breast cancer, lung cancer, whatever patients feel, I don't know. But me as a sarcoma patient, I'm very well or better off at Hadassah Ein Kerem because of the options Sharett doesn't even offer. In the end, everybody has to make a decision. When you live in Jerusalem and you have cancer, you have to make your own decision. But I do recommend Hadassah Ein Kerem, because also I suppose when you have other kinds of cancer, there are still more options. But you have to make your own decision. I'm just talking about my case. And, well, if I'm upset now because I should have moved to Hadassah Ein Kerem earlier. And not only last year. I should have, well, whatever. You can't change it anymore. It is what it is. So that's it. That's my story about changing hospital. Of course, there are also other patients, cancer patients. They go from Hadassah to Sharett. I don't know if it happens too often. I know about one case, someone I know told me, not because of treatment, but because of the oncologist. She wanted someone who is more, who talks more to her, who's more not so busy, because at Hadassah they have a lot of patients. They have more capacities, it's much bigger. They have more capacities, but they also have many more patients. So time is limited sometimes. And this woman who switched from Hadassah to Sharett, she wanted more time. I don't know, but this is my experience, and many people, actually friends and people I know, they told me way before to move to Hadassah. I stuck to Sharett because I got used to it. I knew where everything was, and Hadassah, it's bigger, it's huge, and so you have to find your way, but you also get used to it. I'm finding my way now. Yeah, this is it, and well, you have to make your decision. But as a sarcoma patient in Jerusalem, you should only go to Hadassah, because they have specialists. They have real specialists, not Someone now, someone else at Sharett appointed himself. But I have real specialists at Hadassah, and you have options. You have many more options. So think about it. If you don't only want standard procedure and goodbye, something like this. You want to have some more options, or at least know that there are options in case you need them. It gives you a much better feeling in life. So I will see what's happening in the future, but it was a great decision and I don't regret it. Thank you very much for listening.